think that sounds good, Lauren.
So you can just go ahead and launch us whenever you're ready, Kim.
Sounds good. Well, thank you very much. I really appreciate the invite today. I want to thank Lauren Peretti and Shannon Quinn Sharon from Housing Innovations who are hosting us today and who have also been providing just really, really important technical assistance for the department and for the PATH program. And I also want to thank, of course, Brenda Earl, who works at the Office of the Commissioner, who's been overseeing this program. She's invested a lot of time and dedication, and I really appreciate the attention that she's given to PATH. But I think, I really want to convey the appreciation, not only from myself, but also from Commissioner Navarrete, who I update not only on the PATH program, but on other programs on a weekly basis. And she's been, I think, very, very impressed at the amount of work that's been happening in our state of Connecticut. We're really struggling with a lot right now, as are many other states with the pandemic. But I would say that Connecticut has been very much impacted by the opioid crisis. We know that over 1,300 people died last year as a result of fatal overdoses. We know that our population is already vulnerable. Many persons with serious mental illness die 25 years earlier than the rest of the population, oftentimes because of medications and other trauma that they've been exposed to in their lives. And if not for all of you who are really out there on the front lines and really are kind of the link to the rest of our services, not only behavioral health services, so we know that the department has a continuum of substance use, mental health services, but also many of you are linking people with benefits that they haven't had before. You're linking them with healthcare, many of whom have been disenfranchised from healthcare and are really struggling with chronic health conditions. And some of those connections are actually life-saving. So we really appreciate that. The approaches that I know that all of you are utilizing are very person-centered, they're trauma-informed, and obviously there is a tremendous amount of dedication and compassion that all of you are really demonstrating on an ongoing basis, and that is very, very difficult work, especially in the midst of a worldwide pandemic. So I think that all of your agencies, CHD, Pacific House, CHR, Catholic Charities, BH Care, Perception, on, all of your agencies are they play a really crucial role in the lives of people. And I think that your interventions are really, and I don't think this is exaggerating, you're saving people's lives. So I want to thank you for that. And I, just wish everyone well. And I hope that you all continue to take good care of yourselves. It's really important for all of us who are providing services and connections with folks to be able to do so in a way that, we're caring for ourselves so that we can be there for others. So I'll turn it over to Brenda Earl now, but again, really heartfelt appreciation for all the work that you're doing.
Thank you, Kim. I couldn't agree more. I'm Brenda Earl. I am in the DMIS Housing and Homeless Services Unit. I'm the state lead for PATH. Kim, thanks for your time. I appreciate that you were able to come. I kind of asked Kim to come because everything she said is so right. I mean, you guys have been frontline. You've been out there this whole time through this pandemic when there was no place for people to use the bathroom, no place for showers, no place to get food. I mean, you guys have been out there through it all and risking yourselves, to get COVID or to bring it home to a family member, but you guys have still been out there doing the hard work. And I just really wanted you to know that we see you, we hear you at DMIS. We're making sure the commissioner knows what's going on and how hard you're all working, and you're really dedicated to this very vulnerable, unsheltered population. So just thank you, thank you, thank you. We appreciate your time today. Please ask a lot of questions. I'm going to hand it over to Shannon to get us started, but please keep this interactive. We have 90 minutes together. Let's use it. Let's talk through some stuff that we could do better next year, things that maybe we can improve upon. Let's celebrate some successes. But let's take this time together and really have some good conversation to move forward for next year. Thank you. Shannon, you want to get started?
Yeah, thanks, Brenda and Kim. It's great to have so much support here. And I'll just add my welcome to everybody and thank you all for being in attendance. I want to just cover some housekeeping items. You all joined muted, but we do encourage questions. So if you have questions as we go along, you can unmute by clicking the microphone next to your name if you're on Zoom, or if you're just on the telephone by hitting *6. The slides will be posted to the CT Boss website. They are also posted in the chat. And if you join a little later than they were posted, we will post them again later so that you can see them. Please, you can ask questions, as I said, by unmuting yourself, or you can also ask questions in the chat. We will be monitoring the chat. This session is scheduled to go through 12:30. We may finish early, but we will not go over. And we encourage you all, like Kim and Brenda said, we're here to support one another, and this really is a group effort, and it's great to be able to connect with you all throughout the state. If you do feel comfortable, please turn on your cameras. I think it just helps everyone to know that we are in this together, if you feel comfortable. So with that, the agenda, we'll go through the monitoring goals. We're going to give a plug. The PIT count is very near, so we'll look at the PIT count. Tools that are available for you all to use. We'll look at the key findings from monitoring in 2021. Then we will talk about consumer surveys, the monitoring overview, and more focus on changes. Although we do know, again, we're aware that you all are at all different levels. Some of you have been going through monitoring since the beginning of monitoring, right, with the state of Connecticut, and some of you are brand new. So if you do have questions, ask questions, and we're going to talk about resources coming up for those of you who are newer and just fresh to monitoring in general. We're going to talk about training, and then we'll have time for questions at the end as well. Next slide. So Kim and Brenda definitely already touched on this, and we appreciate that, but we want to acknowledge once again the demands of without COVID, without Omicron, without all of this, path and street outreach is really challenging, right? These are people that are not at the best times in their lives, facing numerous challenges, and we're trying to get them in housing and keep them safe and help them to really stay alive, as Kim alluded to, right? And to get to a place where they can even thrive. So this is very challenging work at the best of times, and now we're all being faced with our own personal challenges, safety, family, our children's schools are being impacted, everything. So we're trying to do what we can to be flexible, to offer support, to offer resources. But please, if there's something that you're needing and not seeing and think that we can be of assistance, reach out. And I'm going to encourage us all right now, again, we're in this together, to take some breaths, as they do at the beginning of the CT Boss meeting. So if everyone could take a deep breath in and let it out. Again, in and out. And one more. Breathe in and out. And next slide. Okay, the goals of monitoring. These goals haven't changed. They're here in front of you if you need to review them. And again, given how tough this work is, our goal is to support you so that together we can make sure each CAN has a coordinated approach to outreach, that we're using all of the resources we can that's effective at ending street homelessness. The goal of monitoring is to learn together what works, create common standards to encourage the things that work to happen all throughout the state. Each year we've adjusted the monitoring guide based on what we've learned and based on emerging needs, best practices. You'll see the new sections as we talk through them. Each CAN is different. Some of you are working primarily in urban areas where there are lots of unsheltered people. Some of you are in a small geographic area and there are multiple outreach providers. And some of you are working in small towns and areas that are mostly rural or suburban, where outreach is going to look totally different. And there's just one agency doing outreach in that area. So I may say this again, but not everything in the guide may make sense or be doable for every single outreach program. So if that's the case, I want to encourage you to take advantage of this, because it's not something we've seen a lot of people take advantage of. But if it's the case that something doesn't work for you, contact Brenda to see if any requirements can be waived. A couple things is it's not necessary to waive. So if there are some best practice recommendations and those are things that you're not doing because they don't make sense for you, you don't need a waiver. They're best practices. And also documentation is reporting documentation, those things are not going to be able to be waived. Next slide. The point in time count is coming up. It's January 25th, Tuesday, January 25th this year. In 2020, which is the last year that we had a quote unquote normal count, there were 324 unsheltered people, which is down from in 2007, the way back when we have first recorded people. It was 811. So the work that you are all doing is making a difference. And of course, there's still work to be done. This year, the count will be based largely, or we'll be getting our numbers largely based on HMIS data, and that includes your path outreach data. And hopefully those of you that it applies to are attending one of the 3 trainings that ACT is giving on the PIT count. There's one today, one tomorrow, and one next Thursday in the afternoon from 1 to 3. The service-based count is not happening this year, but it will be considered next year as a planning tool. Next slide. These are some tools that are available for you all. The 2, as you see at the top, are new. And again, look at where I'm posting things to the chat as we go to see if they're to make sure they're helpful to you. But also these are on the CT Boss website on the resources page. So the first is a modified mini screen. I think we're talking about that later. Yeah, Lauren's going to talk about that later. And then there's the by name list report, which is also going to be discussed later. There's a required documentation item. In section 1, it shows each type of document that's required for individual participants and for whom it's required. So some stuff is required for enrolled participants receiving full case management services. Some are for enrolled participants not receiving full case management services. And then some are for people who are contacted but not enrolled ever. Section 2 provides a checklist of required policies and other documents not specific to any particular participant that PATH projects are required to maintain in your project files. And then section 3 provides links to required forms, sample forms, and other guidance. And the intent of all of this, and in particular the required documentation, but is to help you prepare for monitoring. Then also there's an outreach plan template, a blank outreach plan, and then there's a sample with potential responses that you might have for each outreach plan. There's an assessment and service plan tool, and then a housing target tracking tool, again, to help support your work. Please, if you have other ideas of these type of tools that you think would be helpful, bring those ideas to the quarterly meetings. Next slide. '21 path monitor. So we're going to look at any key findings from the monitoring this past year, and in a few of the past years. Some have been steady throughout the 2 years. We monitor all 8 projects it's a requirement that the PATH projects be monitored every year. So we look at all of them every year throughout the state. Common findings. So first and foremost, and again, this is completely true. We find that your staff has demonstrated resiliency in response to the pandemic. There we go. It's just been challenging, right? And we're all doing the best we can to support one another and to plug in where there might be staff absences, to keep track of the clients and tell one another, hey, I fill in what's going on with the clients when one person's there and another person's not there. So we see that happening, and we see staff filling in for one another when there have been absences, and which there have been. There's been a commitment to risk reduction. There's been efforts to get out masks to people, gloves, hand sanitizer, all of that kind of stuff. In addition to the other risk reduction that was already happening. There's been, of course, creativity in finding ways to build trust with and help clients get housed. We continue to be extremely impressed by your teams. Your staff care deeply. It's 100% evident about their clients. And the clients with whom we've spoken feel respected and cared for by your staff. And in many cases, your staff are the only people the clients say that about. One of the first monitoring visits I did, we went out to a library and talked to a group of participants in the program. And the one woman said, my outreach worker treats me like a human being. And you could just, she said, that's not a given for her. That's not just an understanding that wherever she goes, people will treat her with common human decency. And her outreach worker did that. And you could tell that just meant the world to her. So we continue to see lots of great relationship building happening and creativity. And it's clear that outreach staff don't give up on people. They keep on showing up and they keep on trying new things. Next slide.
Hey, Shannon.
Yeah.
It's Leroy.
Hey, Leroy.
Question. Is there any way that we could get some the strip testers? Because I
Like
see
the at-home COVID test, is that what you're saying?
no, for the benzos.
Oh, benz,
Yeah.
okay.
That I was looking at, I guess they're doing it down in New York or somewhere where that you give them out to the clients and they test their drugs before they use them.
We can look into that for you. That, okay?
All right.
I'm writing it down. We are writing it down.
All right.
And we'll look into that. Thanks, Leroy. That's a good suggestion.
Thank you.
Mm-hmm. So other common findings. I don't know if you all know, I used to be an HMIS lead for another COC, so I'm always gonna come back to data. So there are often discrepancies in data in maybe what would be on the DDAP list versus what would be on the HMIS list, which we'll talk about a little later. So that's a common issue that we run into. There are contract requirements. So who you say, how many people you say you will contact versus how many people you say you will enroll. There are often discrepancies in those numbers. And we understand, like we talked about before, staff turnover results in disruptions in the ability to provide services or actually go out and do canvassing. So that probably feeds into that. And then people have difficulty managing state and federal requirements, data quality issues. And I just want to say again that this year, data quality will impact the accuracy of the point in time count numbers. So looking at data is kind of more important than ever, as if it wasn't before. But we really are relying on it much more closely than we have in the past for the point in time that we report then to HUD. Projects, again, that item that I mentioned before about meeting monitoring standards. So look at the standards, look at if they make sense for your project or not, and talk to Brenda if that seems like something that you might get an exception or a waiver for. And then another issue is coordinating with CAN-wide outreach, having the capacity really, and being able to talk to your whole CAN and see that the whole CAN is covered and reach out to those if there are other outreach programs or providers in different regions that you don't canvass yourself. Having the capacity to reach out to those has been a challenge as well. And ensure coverage for the whole CAN.
I just want to say really quickly here, there is some flexibility on that item this year, sort of recognizing all of the challenges that teams have faced with that. And I'll be talking about that a little later on as well.
Great, thank you. Documentation of services has improved, but it still varies widely from program to program. And staff often report that documentation doesn't consistently represent actual services provided. And then particularly during the pandemic, that's one of the things that falls by the wayside. And it's a catch-22, right? Because during a pandemic, when there are staff, it's more important than ever during a pandemic because there are people that don't usually interact with clients who are going to, and it would be helpful to see what's going on, where the person was left off, what are next steps, that type of thing. Next slide. So why is documentation important? So again, outreach clients, as you all know, probably better than we do, they're great at flying below the radar, right? They want some people on outreach experiencing unsheltered homelessness want to go unnoticed. And the nature of people living outside or in places not meant for human habitation is that they move from place to place quite frequently, and change is one of the more consistent things for many reasons. People are doubled up, they're couch surfing, or they're being asked to move on from an outside site. So documentation helps to make sure people are less likely to fall through the cracks. Everyone has somebody checking in with them. And when the history of what's been going on is written down, we have a better chance of finding somebody. We know where their hangouts are. We know who their close contacts are, who they check in with when things aren't going well. Other team members are able to pick up where somebody left off, and if their housing goals are written out, then we know what the next steps are. And documentation helps us ensure that every unsheltered person is prioritized and of course connected to housing as quickly as possible. Outreach clients, as you know, again, are also good at surviving and getting what they need. So sometimes they do this by continuing to ask different people for the same thing. Documentation helps us to not duplicate what other people have already done, and to conserve the resources that we do have. Outreach clients also have a really high rate of victimization and trauma. We know that being predictable and reliable and not forcing people to explain the same things over and over to different people who they may or may not trust. These are extremely important elements of trauma-informed care. Clients need to know what they can expect from the team as much as possible, given the times, and that people are going to follow through. Documentation also helps establish clear roles and responsibility, especially if and when there are multiple people involved, and ensure that commitments that are made are kept. They ensure people, again, can find clients, know something about them, and what we're working towards. Next slide. So our key findings from the 2021 consumer survey, I think this is the first year that we had a standardized survey and looked at the data and we're able to analyze it statewide. Someone can correct me if I'm wrong on that. But these are the results of the key findings. 10 of the 12 agencies, so CAF recipients and sub-recipients, submitted survey data. The number of surveys submitted for each project ranged from 17 to 1. 94% of the surveys reported that services they would like to get from outreach are available always or most of the time. So just again, more data to show us the good work that you all are doing. 89% of survey respondents reported that they were always treated with dignity and respect. And 89% also reported staff is available always or most of the time to help them if they have a problem or complaint. The most commonly reported service that consumers would like to get but don't receive was housing services, and that was at 34%. So that makes logical sense to all of us. Most of the people that are enrolled in our projects are enrolled because they do not have housing at the time, and hopefully we're working towards that goal for them. Next slide. So the consumer surveys for this year, there are links to the surveys here, English and Spanish version. And then within the next day or so, the next 24 hours, I would say, we will send out SurveyMonkey links to you all by email. The deadline for survey submission this year is April 15th, same as tax day, 2022. So maybe that'll make it easier to remember. So just to be clear, there are links here to what you could use as paper surveys that you could fill out with your clients. But every survey has to be entered into SurveyMonkey. So you can do it with the client on SurveyMonkey, or you could do it on the paper survey and then enter it into SurveyMonkey yourselves. And again, deadline is April 15th.
So Shannon, there's a question in the chat. How can clients complete the survey?
So you can, and now Lauren, tell me if I'm wrong here, but you can give clients the SurveyMonkey link for your particular project, and they'll just go through and click the responses that are appropriate for them, and then that'll be recorded as one survey, or however many survey people you send it to. That'll be recorded for you. Or clients, you can give them a paper survey and then they can give it back to you. And that's another way that they can complete it. Is that clear?
You could also, because you may have some folks that, for whatever reason, whether it's low literacy or other reasons, just aren't going to do it unless you're sort of helping them to do it. So you could also certainly have a staff person do the survey with the client. That might be the most effective way of getting as much feedback as possible, is if you actually are having someone do the survey with the client. It's probably better, if you're going to do that, if possible, to have somebody who isn't the regular outreach worker doing it, because the client might be less, might be reluctant to give critical feedback to the person that they work with most directly, but that may not just be feasible for you guys. So I think each team has to kind of figure out what's going to work best, given the limitations of staffing, and work best for your clients.
At one point, would the clients complete the survey? At any point, or at the discharge?
Any point, no, because they're due. No, it doesn't have to be at a certain phase for when they're receiving services. And even if they did one last year, we would ask that they do one this year. Yeah, so any point in services, and hopefully all of them will be in by April 15th. Yeah. All right. Lauren, it looks like you're talking but muted.
Sorry, I muted myself instead of unmuting myself. Sorry, guys. I was going to say that Shannon is going to send out the SurveyMonkey links within the next few days. So you guys will have those links. We'll send those out by email. So you can have the clients get started either on the paper surveys that are here. Shannon, you can attach those paper surveys to the email also.
Yeah.
Or at any time up until April 15th. You can also have your clients, if the feedback is helpful for you guys in an ongoing way, you can also have your clients do the paper surveys beyond April 15th if you want. But we'll close the window for surveys to be completed for what the analysis that HI is going to do on the data on April 15th. But by all means, use the surveys in whatever way is helpful for your program.
Thank you. Next slide. All right, we're going to get into the monitoring guide, the 2022 monitoring guide. It looks very festive there.
But just so people know, folks that maybe aren't as familiar, right on this slide, there's that the green hyperlink there. So that's a link to the actual guide. And that guide has all of the standards in it that we use when we monitor programs. And we also, whenever we send you, that guide is always on the website, on the CT Boss website. And whenever we send out a notification with a proposed date for when your project is going to be monitored, we send that guide with that notification.
Remote monitoring. So we will be continuing with remote monitoring this year. We've done it even before the pandemic. We started remote monitoring since 2019, and it has been very well received overall. Providers seem to find it less burdensome, less disruptive of their day-to-day activities. So as you probably already know, what remote means is instead of coming to your site, which we have done in the past, we will access records remotely. We will meet remotely. Everything we need to do is remote. We limit what we review to the more critical items. And in particular, we look at new requirements and areas that there were findings last year. We send you a list of documents we want to see for specific clients a few days in advance of the visit. And to ensure that remote monitoring is less burdensome for your teams, we try to keep the list of what we want to see brief. So how we look at those documents is, the documents for clients, and then some of the documents and forms we need to see programmatically. The documents for clients, we have you upload unredacted documents into HMIS, and they don't need to be redacted because HMIS is a secure system already. And then we Housing Innovations receives remote access, you need to contact Nutmeg for that to happen. But we receive remote access to your electronic record system. So our goal is to make it as painless as possible. So please let us know if there are things that you are aware of that could make the process easier. No, I didn't say, I don't know if this is in a future slide, but remote monitoring, it also means, this is not a change from non-remote monitoring, but we also ask that you upload some items into Dropbox, and we send you instructions to do that ahead of time. That's probably on a future slide, but I'm just thinking of it now, so I'm going to say it now. So there are documents for the whole program that we look at ahead of time through Dropbox. Okay, next slide.
We had a request in the chat to put the guide, make the link and the guide available in the chat, so that the actual monitoring guide is in the chat box. You can click on that and open it, or I also put the link to where it lives on the CT Boss website.
Great, thank you. So the elements of monitoring, they are the same as 2021. Again, as I just said, you send some stuff in advance. We look at it in advance. The due date for some of those documents, the programmatic documents are usually a month ahead of time. We meet at the beginning and end of each visit. We do the entrance conference, that's usually at 9 a.m. The exit conference is at the end of the day. We look at the chart reviews at the time in between. And again, we send you a few days in advance of the visit what we want to look at. And we ask that be, we usually ask that be put into HMIS by the morning of the visit. We talk to staff and clients sometime between the entrance and exit conferences. After the visit, we write a draft report. You tell us if you think we missed something or made a mistake in that draft report. And then once we send you a final report, you get back to us a follow-up plan on how you will address the findings, and we give you a template for that follow-up plan.
So, and I just want to say that, we understand that you may or may not have a client that's willing to do an interview with us. And so, that really is, if you have somebody that's willing and shows up, because we also get that you might arrange somebody and then that person doesn't show, and that just is what it is. So that's certainly not going to reflect in any way poorly, in the monitoring report if you're not able to actually get a client. We love to talk to clients when we can, but understand when it doesn't happen.
Thank you. Monitoring guide sections. Again, most of what is in the monitoring guide is identical to 2021. The changes are minor. So here you can see for yourself all the sections, and just to highlight, the emergency preparedness and response section is of course the newest, but that was there last year as well. Next slide. Sorry, I'm a little lost in my. So a reminder, written policies and administrative. You need only submit policies that you haven't previously submitted or policies you've changed. So if, for example, on your 2021 report, there was no finding on education rights and services, that item, and you haven't changed that policy, you don't have to send it in again. If there was a finding on that item in 2021 and you don't submit anything new, the finding will be carried forward, the same finding that you had before. But if you've updated the policy to address the finding, then just submit the updated policy. We'll review it and take whatever actions are appropriate for that new information that we have.
So I think maybe in light of, how much staff turnover has happened, it may be that no one who's currently at your agency has a copy of the 2021 report. And so if you ever need a copy of an old monitoring report, just reach out to Shannon or I, and we have all those records of previous monitoring reports. So if you don't have it, don't struggle with it, just ask us and we're always happy to send it to you.
Thank you. HMIS and DDAP PATH participant list. So this is the same requirement as in 2021, but it was a common place that we found errors. So please be sure to check the list for accuracy prior to submission. And it might be a good idea if you or your agency has the capacity to look at those lists on a monthly, or if not monthly, quarterly basis to make sure they're matching up, make sure entry dates look the same, everyone who's enrolled is marked as enrolled, and everyone who's supposed to be on both lists is on both lists. One common question that I've received on these two lists is because the requirement says, send us everyone who's been active in the past 12 months. And people say, what 12 months? And the easiest thing to do is the date that you're running the report, just use that as the end date and use 1 year prior as the start date. So if I'm running it today, I do 1/12/2021 as the start date, 1/12/2022 as the end date. Brenda, you have your hand up.
Yeah, thanks. I just wanted to jump in and just reiterate how important this is. I know this is fairly new. I think we just started this last year, but I'm a broken record to all of you in our quarterly meetings as far as keeping your HMIS data current and clean. I would agree. I would run these very often. You can run your list. You can even run your PATH annual report out of HMIS as much as you want, just to kind of go through and make sure it's matching your actual client files. I know a lot of you have electronic health records. Maybe you're doing batch uploads to HMIS. Maybe you're using paper files and doing data entry into HMIS. I know everybody does it slightly different, but I can't stress enough how you should just keep your HMIS data clean. It's going to help you at the end of the year with your PATH annual report, and it's going to help you with your monitoring as well.
Great, thanks, Brenda. And there are instructions linked on this slide on how to run the reports. And again, what we're looking at when we are doing the monitoring is that what's on each list matched up. Who people who are enrolled, start dates, end dates, people who've been discharged, like those things should be discharged on both lists.
Can I just, I see Kathleen typed a question in. Kathleen, can you just unmute and ask? I'm not quite sure what you mean by non-enrolled clients.
Yeah, I'm
talking
not
about contacts versus enrollment.
Yeah, I'm not entirely sure either. There was an issue, if I recall correctly, there was an issue between our DDAP list and our HMIS list, because HMIS shows, even, just contacts that are not yet enrolled, while DDAP does not show the folks that haven't yet been enrolled. So there's a mismatch in the numbers and the individuals. And I wanted to clarify and make sure that is either has been corrected or is still understood to be an existing problem.
Right. So DDAP does not show contacts. DDAP will only be enrollments because DDAP captures services. So it's only going to be enrollments. But that being said, your DDAP number for enrollments should match your HMIS enrollments in PATH.
Correct. Yes.
Yep.
Yes.
You're
I think the issue was that the total number served wasn't matching, and there was a question about it.
Yep. Great question. So contacts that you're putting in HMIS, you'll have to pull those out of your final math because it's going to be enrollments in DDAP to enrollments in HMIS. That's the number that should match. So great question, Kathleen.
That is a great question, Kathleen. And just to clarify, so what we ask for in terms of the HMIS participant list that you submit prior to monitoring is just the enrollments, right? So that list wouldn't show all of the contacts. It would just show who was actually enrolled, the date that they were enrolled, and then if applicable, the date that they were exited. Although we do also ask that agencies have some system for tracking contacts. And so apart from the HMIS participant list, which is just people who are enrolled, we also ask for some information about contacts. And I think Columbus House is doing it a little differently than other agencies. So the issue that you're pointing to may not be an issue at every agency, depending upon how they're tracking their contacts.
Yeah, thanks for that question. That's a good reminder for us all about how to look at that information. Jennifer, do you have a question?
Yeah, I think you just answered it because that made me nervous because we don't track contacts in HMIS. So I just want to make sure we're not missing something.
Right, I think as Lauren said, if you have a different system, right? If you have a different system that tracks contacts, that's okay, but we're going to want to see it.
Yeah, and just a heads up that we are working to change that, hopefully in the next year. DEMIS, DOH, CCEH, Nutmeg. We've been having some meetings to try to streamline a lot of these different data systems and to move towards something that does track contacts and links into HMIS. So just so you know, it's on our radar. It's not an easy task, but we are working on that, and we're hoping to have some better answers a little bit later in the year. But yeah, it's understood that a lot of you are keeping track of your contacts in different ways.
I think I see where the question has occurred for us, because when we read anyone that was active in the last 12 months, we're including anybody that we've like that we're working on, even if they've not been enrolled. So just an idea of change that to anyone who was enrolled in the past 12 months instead of anyone who was active.
Yeah,
good
thanks for
idea.
that wording. Yeah, we'll take that into, yeah, enrolled instead of active. Yeah. Okay. I think I'm going to hand it over to Lauren.
Everybody, Lauren Peretti with Housing Innovations. So I'm going to spend the next few minutes walking you guys through some new guidance that DEMIS asked Housing Innovations to create to help support your efforts to make sure that you are only enrolling in the PATH projects folks that are eligible because they have a suspected or determined serious mental illness, right? So, so the PATH funding stream, and this is a SAMHSA requirement, not up for any kind of local discretion, right? These funds have to only be used exclusively for folks with serious mental illness. And so because some of your, people may not be, super eager to go see a psychiatrist to have their SMI documented, the way that that's interpreted for the purposes of the PATH outreach programs is that you can enroll anyone that you know for sure because they've been diagnosed that they have a serious mental illness, or who you have reason to suspect has a serious mental illness. Those are the only people that can be enrolled in the PATH program. And so the SAMHSA definition for what SAMHSA considers to be a serious mental illness is on this slide. I will not read you the definition. You have the slides in case you want to see. It's not super detailed, the definition anyway. For folks that might be new to all of this, I'll just spend a couple minutes talking about the disability verification for the state of Connecticut. So anybody who's been around for a while knows that the state of Connecticut has a standardized disability verification form that's used when a client is willing to have an assessment with a licensed professional who's licensed to diagnose and treat their disability. You can use that standard disability verification form to document an SMI. And the link to that form is here on this slide. that form is posted on the CT Boss website. So that's sort of the gold standard, right? Is to get for as many people as you possibly can, that disability verification filled out. Now, you know, understood that you may have clients that in the outreach context, you know, for whatever reason, you're working with maybe sometimes for years, who are just unwilling to see somebody who is licensed and able to fill out that verification form. So, you know, certainly having that verification form is a good thing. It opens up some housing doors for people, right? There are certain kinds of housing in the state, for example, permanent supportive housing in the COC program, that folks are only going to be eligible for if they have that disability verification. So getting that disability verification is always a good thing. Obviously, if there are folks that you're working with that you suspect have a serious mental illness, having them get a formal assessment from a mental health professional is a good thing, right? Because it helps them, you know, maybe to get linked to some treatment and supports. They're going to help them manage their symptoms and lead a more, you know, fulfilling life. So, so what we look for when we monitor is not necessarily that you've got a disability verification for every single person, because we know that's not always going to be feasible, but rather that you're making ongoing attempts for anyone that you don't have a disability verification for. You're making ongoing attempts to link that person to someone, a professional who can do a formal mental health assessment. But that's not to say that if you don't have the disability verification, you can't enroll somebody in PATH. You absolutely should. If you suspect somebody that has an SMI, but for whom you've not been able to get that disability verification, you absolutely should enroll them in PATH. And there are two other ways that you can make sure that your files have the supporting documentation for that enrollment. So the first one is using some sort of standard mental health screening instrument. I'm going to talk in a minute about one such instrument that you could use. And then you could also just document in case notes why, you know, what's the reason why your team suspects that someone has a serious mental illness, right? Maybe you see them frequently responding to voices, or, you know, other sort of common signs of such a mental illness. Now, we know that your PATH workers are generally not clinicians, and so you know, they may not be in the best position to say whether or not somebody has a suspected SMI. And so what we're suggesting is that call be made in consultation with a supervisor, if that supervisor is a clinician. Sometimes in the PATH program, the supervising folks are clinicians, sometimes they're not, or with another consulting clinician, so that you're not you know, relying on your PATH workers who may not have any expertise in this particular area to make that call. And all of this, what I'm talking about, is documented at the bottom of this slide. You can see this screen hyperlink to guidance on documenting SMI, and all of this is written in that document for you guys. So, so in terms of that second option, which is using some sort of standardized mental health screening tool, this is one such screening tool that some of your programs are already using. It's called the Modified Mini Screen. And this tool is in that link that I just showed you on the previous slide, as well as some guidance on how PATH teams may be able to use this tool to document SMI. So the Modified Mini Screen is basically you know, a standardized screening instrument that's been researched and tested and shown to be reliable for determining who should be referred for an assessment for a serious mental illness. So it's 22 questions. And it identifies possible mental illness, right? It doesn't diagnose someone, right? So what it does is it says, yeah, this person may have a mental illness, and you should refer them to a licensed clinician for a full mental health assessment. It's got 3 different sections that each you know, ask questions in 3 different areas: mood disorders, anxiety disorders, and psychotic disorders, right? There may be other kinds of psychiatric disabilities that the tool is not going to pick up on, right? And so again, it's not the only way that you can enroll someone that you suspect has SMI. It's just one way. So the tool also can be either self-administered by clients, although when you look at it, you'll see that for your clients that may have some cognitive barriers or literacy barriers, it's probably not going to be feasible for folks to self-assess the tool, to self-administer the tool. So you'll want to have a staff person read the questions to them. And it's a tool that's designed so that it can be administered by non-clinical staff. And there's a whole lot more guidance in the document that we just looked at the link for. And we're also going to do a training on this for you guys coming soon. So it takes about 15 minutes to administer the tool. And it can have, there's some good reasons besides just an easy way to document that somebody has suspected SMI for the purposes of enrollment. There's some good reasons why your project might want to consider using this kind of tool. It's not a requirement that you use it, but just another tool in your tool chest that you guys might want to consider. So it can help to identify suicidal ideation so that you guys can make sure your team has a plan for helping to make sure that people are, as much as you can, that there's some sort of safety plan for someone that has suicidal ideation. And it can really also just help your team to understand what are some of the mental health symptoms, challenges that someone's facing, just as another piece of information that you can use in your work with the person to help what additional supports and referrals you should be making for someone. So super important. We always want to make sure that the PATH programs are low barrier, right? So we don't want to create a whole bunch of bureaucratic administrative hurdles that someone has to jump through in order to gain access to the program. So the MMS really is a way to screen people into the program, not to exclude people from the program, right? So if a client says to you, no, not interested, I don't want to answer any of these questions, or you get 3 questions in and they say, nope, not for me, not doing this, and they bow out, that's totally fine. It's not a requirement that the client answer any of the questions, right? You can still enroll someone even if they don't complete the MS. And you would do that again just by documenting in the case notes what are the reasons why you suspect that someone may have an SMI. And then we said this already, so the MMS is just one way to document SMI. It is not certainly the only way to document SMI. So we are going to be doing a webinar for you guys. Actually, Andrea White on the Housing Innovations team is going to be leading this webinar. I don't think, Shannon, I don't think we got the announcement out for this yet, but we will be soon. Is that right? Okay. So in the next couple days, you guys will see in your email an announcement with a link for this webinar. But if you want to put it in your calendars now, it's going to be on February 16th from 1 to 2:30 p.m. And Andrea will go through a whole lot more information about the MMS than I just did quickly for you guys now. Are there any questions about and I see Shannon also put, while I was talking, links, thank you, Shannon, to the disability verification form and to the guidance on documenting serious mental illness, which includes the actual MMS tool right in that guidance. Any questions on that before I move on? I know it's new.
Could I jump in with a question?
Yeah, sure. Hi, Ron.
Hi. With regard to the modified mini screen, sometimes self-reporting is not as forthright or as honest as you might hope. If a caseworker were to believe, based on observation, that attributes in the modified mini screen were true, could they report them as such and use that as a basis for SMI?
Absolutely. It's a great question, Ron. And it's actually, that question is actually addressed in the guidance, right? So you could have a client that you can see is right responding to voices, a lot, right? But when you go through the MMS and the client, you ask the client all these questions, they say no to absolutely every single thing. And the client scores 0 on the MMS, you can still enroll that client in PATH, right? You just document what the basis for why you're doing that is in the case notes. It's a great question, Ron.
Brenda,
Anyone else have questions?
Brenda's hand is up.
Hey, Brenda.
Yeah, I just wanted to also just kind of reiterate what Lauren's saying, that this is not like a requirement. I know sometimes that gets lost in translation, especially if you have subcontractors with PATH and you're communicating this to your subcontractors. This is kind of a response, if I'm correct, Shannon and Lauren, correct me if I'm wrong, because this was something as providers you wanted over the last couple of years. I think there was some concerns with PATH workers who are out there kind of in the encampments, out looking for people, nervous, like, okay, well, there's no documentation. Am I enrolling the right people? So this is kind of just here's another tool for you that can be helpful, even though you might suspect it. Maybe this will give you a little more sense of, okay, I was on the right track with it. But it's not something that if it's not in every file, you're going to get a finding. So I just want to be really clear with that.
Thanks, Brenda. Super important. Anyone else have questions about this before we move on? All right, jump in if you think of anything. So this is another new tool. So our friends and partners at CCH created this for you guys new this year. It's called the PATH by name list crosswalk report. And there's a link to the release notes that CCH created to help you guys understand what this is and what its purpose is here on this slide. So basically what it is it's an HMIS view that lists for every client that you currently have enrolled in your PATH program, what is that person's status on the by name list, right? And so the intent is for you guys to, whenever you want, be able to run this view and see for every person that's enrolled, what's their status on the by name list, right? So that you can make sure that all of your enrolled folks are correctly on the by name list so that they're not missing out on housing opportunities. And so that really is the intent of this tool, the intent of this resource is as a tool for your teams to make sure that people are not falling through the cracks in the CAN matching process. So if when you run this view, right, you see like it doesn't make sense to you what's on the by name list, what's recorded in HMIS on the by name list, then what you would do, I think, is reach out to your CAN manager to say, like, we have these 5 clients that we don't see on the by name list, why, or we have these clients that are on there, but the status doesn't make sense to us, right? Because I think it's the CAN managers in each of the CANs that are managing those statuses and those lists. So if I've misspoken in any of the CANs and you guys want to clarify how it works in your CAN, because I know it can be a little different from CAN to CAN, please don't hesitate to speak up. And so what we're going to do for HI's purposes is just to make sure that you guys, know how to run the list or using it as a resource. We're going to ask you when we, every time you get a monitoring notification from us, we send you a list of things that we want you to submit in advance. So we're gonna ask you to also submit this PATH by name list crosswalk report with those documents, and then we'll be able to also kind of look at that list against your PATH enrolled list to see, and help you guys to see, are there disconnects here? And if so, what are the next steps to try and maybe resolve some of those disconnects? Really, all of this is in the spirit of making sure that unsheltered clients are getting access as rapidly as they can to the housing resources that exist in your CAN, which I know is all of your primary objective as well. So
I just wanted to jump in. And just to also and I know there's some of you that are new, and please, if there's acronyms we're saying that you don't know what they are, I feel terrible, just feel free to jump in and ask. But also there was always kind of this looming myth, right? As far as outreach teams that are canvassing, that you had to get somebody into a shelter bed in order for them to kind of start the process in the system, as far as getting assessed and getting onto the by name list. And then from the by name list, getting discussed at a matching meeting, and then from that, getting matched to housing. So we just want to debunk that myth. As outreach workers, you can be doing that process. You can be making sure they're on the by name list, or working with your CAN to figure out how you can put them on the by name list, which, if I believe at some point, if it's not active now, CCEH is working to update HMIS so that as soon as you enroll somebody in a program in HMIS, they automatically go on the by name list. So PATH is considered a project enrollment in HMIS, so that should automatically happen. But we just want to kind of debunk that. There's not enough shelter beds in Connecticut. There's never going to be enough. The goal should not be wait for shelter, wait for shelter. It should be get them shelter if they want it and they need it to be safe. But if there's not a shelter option, or they prefer to stay where they are until they're housed, that's okay too. Just make sure they're on that by name list and you're advocating for them at those matching meetings.
thank you, Brenda.
Yep.
All right. So I alluded to this change earlier when Shannon was talking. We know that it's been a huge challenge for PATH projects, given your enormous responsibilities and very limited staffing resources, to be able to coordinate with every other organization that's doing outreach to people experiencing homelessness in your CAN, which was originally the intent of the outreach plan template, was that it would be a CAN-wide plan that was a tool to coordinate not just within the PATH program, but across outreach programs in the CAN. And by all means, I think there's some CANs that have regular outreach meetings where that coordination is happening. And those things can, in a fairly straightforward, not super time consuming way, get documented on that outreach plan. And by all means, if that's the case in your plan, please continue to use the tool as it was originally intended to really coordinate CAN-wide outreach across all of the agencies that are doing that outreach. But we also want to acknowledge that that's not the case in every CAN, and that it's not necessarily feasible for the PATH teams to be able to coordinate such meetings to do that, to get that information on the PATH outreach plans. And so this year, what DEMIS is going to look for when you submit those plans is that you've got the information on there at least for your PATH program, but not necessarily for other providers who are providing outreach services in your CAN. And then when we come and monitor, when Housing Innovations comes and monitor, we'll ask you, or actually we probably already have, because we'll get them from Brenda, your most recent approved PATH outreach plan. And so that's all we're going to be looking for, right? We're just going to be looking for, did you submit the plan to Brenda? Did she approve it? And if she didn't approve it, there was some reason why she couldn't approve it, something else that she asked you to do on it. Did you, close that loop and do whatever the thing that Brenda asked you to do was? That's all we're going to be looking at. We're not going to be delving into the details of the plan. Brenda will look at those. Brenda will approve them or let you guys know what else needs to be done on them. And then this is the same as in previous years. So the things that are in red on each of these slides are changes. So those two things are the changes. And then what's the same is that you're still going to be asked by DEMIS to submit those plans once every 6 months, and to have your CAN sign off on each of the plans. And then the deadlines that DEMIS has established for the due dates for those plans for 2022 are March 31st and September 30th. And for anyone who's new to all of this and maybe not so sure what I'm talking about, please take a look at the training that we did when these plans were first launched. That webinar and those slides are linked here on this slide. All right. So another new thing is that obviously, I don't have to tell you guys this, you all know this, that vaccination and making sure that people are fully vaccinated and boosted is one of the most important things that we can do to keep our clients safe, to keep our staff safe, and to keep our community safe, right? And so we added a few standards in the infection control section of the monitoring guide related to that super important effort around vaccination. I won't go through all of them, specifically what they are. They're pretty, I think, non-controversial and, just kind of what you guys are doing already. And the details are here on this slide. We also every year, whenever we can, try to find opportunities to simplify and consolidate things. So we did a little simplifying and consolidating in the infection control standards. So there are fewer standards than there were previously in that section. All right, so we've been talking throughout the course of the webinar today about the ongoing challenge that you guys and frankly every other employer in America is having in recruiting and retaining staff. So we know that there's been a ton of turnover in the PATH program, and it's likely, the labor market dynamics are what the labor market dynamics are. None of us can control that. It's likely, unfortunately, that that's going to continue to be a challenge. And so we wanted to provide something that helps support you guys in your ongoing effort to onboard new staff as positions turn over. And so Shannon and I are going to be doing in February, on February 8th from 10 to 11:30, part one of an onboarding webinar series. There will be a part two, and it's really just meant for folks who are brand new to the PATH program, to orient people to the basics of what the expectations of the PATH program are. What is HMIS? What is the by name list? What is the PATH annual report? Plus the basics of what the service model, right? What is Housing First, right? What is low barrier services and trauma-informed care, right? Just some of the basics of the approach to outreach that we use in the state of Connecticut. And so we're going to do a live webinar on the part one on February 8th, part two on a date that we will announce as soon as it's available. And then those will be recorded. And the idea is that it'll be an ongoing tool that as new folks come on your team, if it's helpful, you can have them review these pre-recorded onboarding webinars. So we hope that that's helpful to you guys. And then another resource that Demas has made available to you guys is, again, Andrea White on the Housing Innovations team is going to be convening monthly community of practice case conferencing sessions on Zoom. Because it's a lot of people statewide, I think the group has been divided into two groups geographically. Cohort A has already decided that they are going to meet on the second Thursday of each month at 1 p.m. And I think Cohort B decided that they'd like to do a doodle poll to figure out when is best for most people to meet. And so the date of that is to be determined.
So can I just give a plug? If you haven't filled out the doodle poll, please fill it out so we can choose a date that's best for most people.
If you're in that cohort B.
Yeah.
So you would have got, if you got the doodle poll, you should fill out the doodle poll.
Yeah.
If you did not get the doodle poll, you're in cohort A and you are meeting on the second Thursday at 1 p.m. So and then the idea here really is an opportunity for you guys to learn from and support each other with a little bit of technical assistance from Andrea, right? So You guys are going to decide in each of those groups what's the topic that's most burning for this month. And then Andrea will send out in advance of each session an agenda with the topic and some questions to start some discussion and a case conferencing outline. And the idea is that for you guys to think about, do we have a client who is either struggling with this issue that is the topic of the month, or who has overcome this issue, and that we think we've got some great best practices to share on how we help the client to overcome this thing that we want to share with our other folks on our cohort. And so if you guys can think of somebody in advance, that always makes these sections, I think, a lot more productive for everyone. And then at the end of each session, you guys will decide what's the topic you want to focus on for the next month. And so all of the PATH staff are invited to attend. And I think Demas has requested that if your staff are going to attend, that you also have your supervisor attend. Brenda, you have your hand up.
Yeah, I'm sorry. I just saw Carrie asked a question in the chat, and I just she wants to be added to that list. But I actually, Carrie, your question kind of just prompted me. Because of the turnover, obviously my email lists are only as good as the information I get from providers. So please remember, as you have staff turnover or staff changes, to email me who the new people are, if I'm taking someone off a list and adding someone new to the list, or if I'm keeping everyone you already have and just adding a new person. Because when we send these out, if you haven't started yet, you're not going to get these invites. So Carrie, I have added you actually to all of my lists, but you're correct. You probably didn't get this information yet because it went out before I think we knew to add you. So we'll make sure you get it, but please, please, please let us know when you have staff to add to the list.
All right, will do. Thank you.
So we'll get an updated list from Brenda. So Brenda maintains the contact list, and then we get updated lists from Brenda periodically that we use to do any communication that Housing Innovation does. So Shannon, if you could just get an updated list from Brenda before we send out the next round of whatever it is, consumer surveys, community practice, et cetera. All right. And then these are just some other training resources that are available on the CT Boss website, on the training page on the CT Boss website. So this green hyperlink here will take you to the training page on the CT Boss website. And there are a couple of different places where you'll find trainings that are specific for outreach staff in Connecticut on that page. So the onboarding webinar, it's going to be 2 90-minute sessions, right? So it's not going to go through every single thing that your outreach workers are going to need to know. It really is intended to be a pretty basic overview. It won't go a lot into depth on all of these topics. So in addition to having new staff attend the onboarding webinar, you may also want to have them view some of these trainings that have previously been provided and are recorded and are up at this link. So there's training on housing location and housing stabilization. There's training on how to work with people with mental illness, right? Some of the staff that you're hiring may not have any experience previously working with people with mental illness. There's training on how to do needs assessment and service planning with people. There's training on what the expectations are for people in housing and how to get people ready to make that transition from the streets and into housing, and how to support them once they're in housing. And then training on how to help, I think this can help workers understand what the housing options are, and then in turn the workers can help clients to understand what the housing options are. So all of these things are available. As always, if there are other trainings that you think would be helpful for your team, please let us know or let Brenda know, and we will do our best within the resources that are available to get those trainings developed and up as quickly as we can. All right, so I think that brings us to the end of our slides. So we are happy to take any questions that you guys might still have. any feedback that you have on how we can make monitoring work better for your teams. And then if there's anything, questions or feedback that you want to share after today's session, my contact information, Brenda's contact information, and Shannon's contact information are here on this final slide. Any questions, comments, feedback?
If there's no other questions, I just wanted to take a quick minute and let all of the providers know the reason we're able to have Housing Innovations provide so many webinars and trainings and the community of practice is because Connecticut received some additional funding from SAMHSA for our PATH program. Unfortunately, it wasn't for direct service, which I wish it was for that. I would have sent that out into your contracts, but it was just kind of a small amount for additional training and technical assistance. So we were able to quickly, DEMIS met with Housing Innovations probably within the same week we were awarded that funding, and we were able to put together some pretty good ideas just from your feedback over the last couple of years through monitoring and just different outreach meetings to really put together some stuff that we think is helpful for you. Now, again, your feedback is so important. If you find, hey, we don't need this, maybe we need something different, these trainings aren't necessary, please make sure you're emailing us that information because we want to support you, as Lauren and Shannon have said. So we're just trying to, put the best things out there that we think you want. So just let us know if we're on the right track. The onboarding was big. I know that that's been something that's been the last couple of years. So we're really hoping that provides a big, like an overview of PATH. So as you bring people in, they can watch that webinar and go from there. There's a lot of systems with PATH. I'm aware that that's a burden. I know, SAMHSA has PDX. That's what you do your annual report in. You have the DEMIS DDAP system. You have HMIS. You might even have your own electronic health record. And sometimes none of that talks. And I understand that that's been burdensome. We've heard you loud and clear. We are working with Nutmeg to try to streamline some of that to make it a little bit easier. I should have more information by April on if we're able to do that streamlining. Thankfully with BOSS, with Housing Innovations, we were able to find some money through the COC to really push that streamlining because PATH it's not a lot of money, but it's very data heavy in a lot of different data systems. So we hear you and we're aware of it and we're trying to address that. And I just also want to thank Housing Innovations. If I could just thank Lauren and Shannon. I think sometimes you guys are the unsung heroes. DEMIS contracts with Housing Innovations just the same as we contract with all of you. You're all providing the much needed services on the ground. But as you can see, Housing Innovations takes a lot of that load off of my plate. They're able to really dig in, get some best practices, some guidance, some training, some webinars that you guys need. So on behalf of DEMIS, we thank you and we appreciate your support to the providers. And that being said, my last plug, since I have you all, is the PATH application is going to be really early this year. You're going to start getting 1,000 emails from me. So just, keep your eye out for Brenda Earl emails and please be timely with your responses. They pushed the application up by 2.5 months. So you should be working on your intended use plans and your budgets now. The final application for Connecticut's going to be due in March. So you could work off the budget from last year until Congress passes a budget. It's the same amount as last year. But you'll get emails, you'll get more information from me. I just wanted to take advantage of the moment and plug that. Please be working on those intended use plans.
So just one final housekeeping thing. We will get the recording for today's session up within the next day or two. It'll be on the CT BOSS website, www.ctboss.org, on our training page. For anybody that either missed part of the session this morning or anybody on your team who wasn't able to join us.
The link is in the chat also for that.
Thanks, Shannon. So, and thank you guys for everything that you do every day to keep people experiencing unsheltered homelessness safe. particularly in light of the pandemic, and to get them housed as quickly as you can. We are inspired by your work and honored to be able to help out in whatever little way that we can. So bless you all and thank you.
Thank you.
Thank you so much.